Good evening. Good evening to those that are joining. Just readjusting here a little bit so I can see the comments here on the gram. Good evening to those that are joining. Thank you for popping in to the broadcast. And if you know anybody that may be interested in our topic this evening, we are talking about lymphedema this evening. If you know anybody that may be interested, if you know anybody that is a cancer survivor, and a cancer survivor is anyone that has been diagnosed with cancer. From the moment of diagnosis, they are a cancer survivor. So if you know of anyone that may be interested in this information this evening, we're talking about lymphedema, and lymphedema can actually affect anyone that has had cancer treatment. So if you know anybody that has had any type of cancer, then please do go ahead and tag them in the comments. It's an excellent time for that. Go ahead, like, share, comment, tag persons in the comments that you do think may be interested in our topic or that this information may affect. Okay, it's always the more the merrier. I'm just putting the topic up here on Facebook. Good evening to you all. So thanks so much for that compliment. We will be getting started in a mere moment. Okay, in just a moment. Just giving you an opportunity to share. I'm going to do the same. I think I just lost my internet connection over on Instagram. That's how it's looking. That's how it's looking. Okay, let me see if I can get let me see if I can get a good old Instagram back up. Let's see. The Gram is like, nope. Or at least I really can't blame Instagram. I think my internet actually went down over here. So let's go ahead and make an adjustment and see if we can get Instagram back. Okay. Y'all let me know, Instagram, as soon as we are back. Y'all throw me up some hearts or something if you can see and hear me as yet. Let's see. I might have to come out and come back in, see if I can let it catch back up. Just gotta love technology. All right, y'all. So take two. Let's see if we can get Instagram back up. I think we're back. We are back. We are back on Instagram. So let's let persons rejoin over here on Instagram. So that just gave us another moment to go ahead and like, share, comment. Okay, if there's anybody else that you think may want to get this information this evening, our topic this evening is everything they didn't tell you about lymphedema. All right, and we're going to get going in just a moment. Thanks for popping back in. Okay, we just had a little internet breakdown over here on Instagram. So thanks for rejoining the broadcast. Nice to have you back. Okay. All right, so I'm going to go ahead and get rolling. So, for those of you that may not be familiar with me, I am Dr. Felicia. I'm a physiotherapist and a certified lymphedema therapist. Okay, I am the proprietor of Adley Physiotherapy, located over on Mackey Street in the Mackey Street Plaza, formerly known as the Meldon Mall. I have been in operation for 6 years and I have been a registered physiotherapist here in the islands of the Bahamas for almost 10 years now. Okay, 9 years, it will be 10 at the end of this year. Can hardly believe it's been that long. And over those 10 years, I have helped hundreds of patients reach their physiotherapy goals. And I hope to help so many more women reach not only their physiotherapy goals, but also their general health and wellness goals in the future, as I am also a health and wellness coach, a certified health coach. Okay, so thank you again so much for joining me. And I just wanted to speak a little bit this evening again on the topic of lymphedema, since it is an area of specialty of mine. Now, it's important to know that any information that's discussed in this broadcast is not to be taken as medical advice. I don't know the particulars or specifics of anybody's individual case, and I am just giving some general information this evening, some guidelines. Hopefully, that can help some persons and they can then reach out to the healthcare, the relevant and appropriate healthcare providers that can then give them some more individualized assistance. Okay, y'all. So let's jump in. Our topic this evening is everything they never told you about lymphedema. So let's talk about a few statistics. The statistics can be very telling, very compelling. So let's look at some stats. 140 to 250 million people worldwide have lymphedema. Million. Okay. 10 to 40% of people who have surgical treatment for cancer develop lymphedema within the first year. 10 to 40%. That's almost up to half. So it's not as rare as people may think. It can happen. It is a very real possibility for persons that have had cancer and that have had some treatment for that cancer. We know that cancer treatment is a necessity in order to save a person's life. And although it's necessary, it can be rather brutal. It's very, damaging to even the healthy cells. Okay, and this is a serious issue. We know that we have a very high incidence of cancer here in the Bahamas, particularly breast cancer. And of course, there's treatment for this cancer, and then there are some lingering side effects, deleterious effects, negative effects of cancer treatment. And lymphedema is one of those unfortunate after effects. And so 10 to 40% of people will get lymphedema within 1 year of having cancer treatment. In 5 years, that number becomes 50 to 75%. Okay? 50 to 75%. So you see the incidence actually increases as time goes on. It is a very real possibility for a lot of persons that have a history of cancer. So what is lymphedema? Lymphedema is the accumulation of protein-rich fluid in the tissues. Persons may be very familiar with the terms lymphatic system or lymph drainage or lymph massage. They're becoming very popular terms, I do believe, because of even some plastic surgery procedures. Persons are using manual lymph drainage to help and maximize the effects of the plastic surgery that they have, because the lymphatic system is very important to all of us. Although we may not think about our lymphatic system as much of our other systems when our lymphatic system is healthy, we think about our digestive system, our circulatory system. We think about those systems so much. But a lot of times, the lymphatic system is not really a thought for us, but it's working for us every day. And it is not to be ignored. So, what happens in lymphedema is that there is some sort of an insufficiency in the system. And as it would relate to lymphedema, lymphedema can be either primary or secondary. Primary lymphedema basically refers to when something is like congenital, it was there at birth, some sort of malformation of the lymphatic system. So it was never formed correctly in the first place. Then, when you think about secondary lymphedema, that would be how you would categorize lymphedema that would arise after something like breast cancer surgery, where there may be lymph nodes taken out, a part of the lymphatic system may be damaged. And just on a side note, what can happen also with plastic surgery, let's take liposuction, for example, when they're in there and they're sucking out the fat, there can also be some damage to the lymphatic system in that case. But the lymphatic drainage is something that can be useful for many different diagnoses. It can be used in the treatment of swollen hands. It can be used in the treatment of swollen, painful, sprained ankles. It can be used post plastic surgery for persons that have had BBLs, because of course there's all of this fluid. So after almost any surgery, there is post-surgical swelling, and almost any type of swelling, the lymphatic system can assist with it, with the uptake of that extra fluid. And there are, of course, benefits in order to get that extra swelling out so that a person can have more function, they can have a better appearance, they can have better movement. So, of course, manual lymph drainage is a good thing. So, there are different stages when we talk about secondary lymphedema. There are different stages. There are 4 stages, starting with stage 0. Stage 0 is the latency phase. And the latency phase is basically what a person would be in after they have had perhaps breast cancer surgery that has affected some of the lymph nodes or other parts of the lymphatic system. In stage 0, it's the latent period, so nothing is really happening. There is no swelling that you can see. There's a reduced capacity, however, of the lymphatic system to move the lymph. So there is an issue, but the issue is not obvious. So when you get to stage 1, then stage 1 is when you are starting to see some swelling. There is, however, the ability for the swelling to still spontaneously reverse, because with elevating, the swelling can go down, for instance, overnight. So the person may wake in the morning and then the swelling is like, oh, okay, it's gone. So the swelling will still be going up and down in this particular stage, stage 1. The swelling, however, is a soft swelling. And if you were to push in on the swelling with your finger, you would see that for a few moments it would actually stay depressed and then eventually fill back in. And there are no skin changes in stage 1. So the skin is still looking nice, it's intact, not like how it would look in the other stages. Okay, so the skin is usually still nice and healthy. Stage 2, this is when it gets real. Spontaneously irreversible stage. So this is where the skin then becomes hardened. The person is then prone to infections. the swelling no longer indents because it's become hard. If you're familiar with the term fibrotic or fibrosis, the tissue is starting to become fibrotic, okay, which means basically hardened, okay? So it's not kind of like soft and pliable anymore. Stage 3, final stage, lymphocytic elephantiasis. If you ever have seen or heard of, we call it the bends. If someone goes down, they dive out in the ocean and they come up too quickly, and then they get like a huge swollen limb, right? And then they have to go through the whole thing with the chamber. Being in the hyperbaric chamber is one of the treatments for that, right? So when you think about elephantiasis, if you get a picture in your mind for what that looks like, that is basically what a limb looks like when a person has stage 2 secondary lymphedema, that is stage 3. In this stage, then there is skin breakdown. You have a deepening of the skin fold. So when it's very large, it can almost look like the skin is like folding or lapping over on itself. The limb size is increased. It's very, very large in this stage. And there are frequent infections, okay, which is no good. And by the way, when a person is in active infection, they cannot get active lymphedema treatment. They can't get complete decongestive therapy. Okay, they can't get it. It's not appropriate to be spreading it around. But of course, this is the importance of making sure that when you choose a provider to give you service, because you have many places that you could get manual lymphatic drainage. But you always want to make sure that whoever you get this treatment from, that it is someone that is reputable, someone that is legitimate, someone that is trained. You have a lot of persons that say that they do things, but make sure that when you go into these establishments, you're looking for their certificates on the wall and things like that to make sure that they have actually trained in these different things. Because what makes the difference is knowing what is appropriate and when it's appropriate to do it. Because not every treatment is appropriate in every situation. But these are the things that you learn as you go through your different levels of training. So forgive me for going off on my little soapbox there, but I do believe that it's important to qualify yourself so that you don't hurt the general public. You never want to be hurting more than you help. So here are some things you need to know. So once a person has breast cancer treatment that damages the lymphatic system and they do not develop swelling, it's stage 0. So even if they don't see anything, that's stage 0. Once they've had some sort of assault on the lymphatic system after a surgery, breast cancer surgery, radiation as well can damage lymph nodes and parts of the lymphatic system. And once that has occurred, stage 0. But when you start to see something, it's no longer stage 0. Number 2, once lymphedema hits stage 1, there's no turning back. There's no reversing through the stages. If a person is stage 2, they don't just spontaneously go back to stage 1 or 0. Doesn't happen. Lymphedema is a progressive disorder. It's just going to keep going. So if a person is in stage 1 and they do nothing, they get no treatment, no attention, no help, they are going to continue to progress through the stages. They're going to go from stage 1 to stage 2 to stage 3. And if y'all want to Google some pictures of stage 3 lymphedema after the broadcast, be my guest. Not a pretty sight, okay? You don't want to get there. Yes, so number 3, there is no cure, only treatment. There are always things that are in like experimental phases. Sometimes people want to ask about surgery because, of course, people want to get rid of lymphedema. No one wants to hear, I have to live with this for the rest of. And it's a lot to take in because it's a lot. It's a commitment. It is truly a commitment to take care of a limb that has lymphedema for the rest of your lifetime, because there is so much work involved. I do believe that once persons accept it as a part of their routine, it can become easier, but it is really and truly a commitment, because the complete decongestive therapy has to continue to be carried out. And I do want to drop this little nugget right here. Just going out and getting a compression sleeve is not treatment. So if a person has lymphedema, the correct course of action is not to just go and buy a sleeve or order an over-the-counter sleeve. That is not treatment. That is something that should occur once a full course of treatment has occurred. Okay, so don't believe that hype that, okay, well, just go get a sleeve and put that on, and that's going to, no, that's not going to do it. Okay, so make sure that you are going through the proper channels and that you are getting the correct information, so that you're not just either making it worse or progressing through the stages while you think that you're helping by simply having a sleeve. It's not going to get the best results. Complete decongestive therapy is a 4-part treatment, and what I tell people is that you can't do like one or two and not the others and expect to get the best results. Doesn't work that way. It's designed where all 4 of the parts of the treatment work together, and they help and reduce the size of the limb. You try to get the maximum reduction over the treatment sessions, okay? And then it's time for a sleeve. Just saying. All right. Number 4, don't allow, if you have had breast cancer, for example, and you have had lymph nodes removed from a particular side or both, do not allow needle sticks on that side. Try to avoid insect bites. Okay, so if you have to load up on that off in the summertime, please do that. If you need a mosquito repellent bracelet, please get one. Okay, but try to avoid those insect bites. Also don't allow persons to do any blood pressure checks on that particular limb. Number 5, avoid heat or extreme temperatures. So here in the Bahamas, could be a challenge. We're having some very, very hot days. But things like hot tubs can be avoided. Okay, so you avoid the extreme temperatures where you can. So avoid hot tubs, like extremely hot baths. If you can, like, kind of protect yourself with a nice broad brimmed hat if you're going to be out of doors, which you should be doing anyway. Let me just also drop in there, go ahead, as a part of cancer prevention, go ahead and put on your nice SPF. Lowest SPF I would use, and I am no skincare expert. I would say more on the cancer side, but I'm no dermatologist. But I personally don't go with any SPF that's lower than 50. Okay, don't forget to put it, on your scalp, where your part is, the ears, the back of your neck. We're in a sunny tropical climate, and although we have melanin in our skin, many of us, you want to still go ahead and get that sunscreen in. Okay, remember to reapply, especially if you're out at the beach this summer. Okay, make sure that as you're out there enjoying it, that you are, protecting yourself as well. Just an extra little tidbit there, and that's for everyone. Number 6, wear a compression sleeve for airplane travel. So you can actually get a sleeve. This is if you're like stage 0, not if you have like full-blown stage 1, 2, or 3. If you are someone that has, for example, had breast cancer, and you would be considered stage 0, no visible signs of swelling, but you know that you've had this assault on the lymphatic system, you can get a sleeve that you can wear, okay? And you would want to utilize that, for instance, for airplane travel. The reason that you'd want to do that, airplane travel is one of those things that can actually kind of trigger lymphedema in the same way that the needle sticks, insect bites, and things like that can. So this is just like a precaution or a prophylactic measure. And then you want to wear that sleeve because of course, you have those changes in cabin pressure. Wise to have that sleeve, okay? And if you need to be measured, it's important to get the correct measurements of the arm so that a person has a well-fitting sleeve. An ill-fitting sleeve is not helpful. I have seen persons walking around with bags of compression garments that don't even fit. And compression garments are not necessarily the cheapest. Okay, so definitely, if you want to make sure that you get it measured right, if at all possible, the first time. Okay, so if you do need to see me for a measurement of a compression sleeve, then and so that you get the correct compression grade and all of that, then of course do feel free to reach out to me. You can either DM me, you can call or WhatsApp. Okay, and of course the number is available on both of these outlets. Okay, and you can also check the website. You can do request an appointment on the website, which is adderleyphysio.com. All right, let's see. Number 7, don't wear tight or restrictive clothing. Example, shirt sleeves that are too tight. Again, another potential trigger for lymphedema. Nice loose fitting clothing. So if you can get away with either sleeveless in the summertime or something that's just more loose and flowy in the arm area if it's been breast cancer. If it's, let's say, a cancer, perhaps a gynecological cancer like ovarian cancer and lymph nodes have been removed from the groin area, then you want to wear dresses, loose fitting pants, okay? Not the suck it to me's, all right? Number 8, once you have lymphedema, it requires a lifetime management. You need to be adequately educated on how to care for your affected limb to reduce complications. Things like infection, no bueno, okay? And number 9, lymphedema is expensive. If you have lymphedema, get quality supplies that will hold up. A lot of these supplies, they are quote unquote perishable. They will need to be replaced every so often. Okay, but if you want things to like maintain their elasticity and their effectiveness, then that simply must be done. And of course, I have suggestions for you about how to get these different things paid for, etc. Okay, so I got a few ideas. All right, so which brings me, and those are my points. Those are just some things I would say that are the basics that a person would want to know if they are a breast cancer survivor or any type of cancer survivor about lymphedema. Okay, just for starters. And if you want to get a consult with me to get some effective strategies to manage your condition or treatment, or more strategies for how to prevent getting lymphedema, okay, then please do go ahead and reach out to me through the channels that I mentioned earlier, DM, WhatsApp. You can also check the website for a request appointment, okay? Any of those methods, you would be able to reach me to go ahead and book a consult so that you can get in and you can get some help and assistance, okay? That is what I have for you this evening. And I am ready to take any questions that you may have. If you want to put them in the question queue, you can do so. If you would like to ask your question live, then send me a request to join and I will go ahead and add you to the stream so that you can ask your question. Okay, so I'm going to give it another moment or two. I'm going to just scan back through the comments here. Squeaky Clean 123 says, hello, how are you? I am well. How are you doing? Thank you for coming on to the stream. Hello to all of those that joined in the midst of. Good to have you here. Thanks for coming. Thanks for putting up with my technical issues as per usual. You're always so gracious. All right, so let's see. While I'm giving it a moment to see if there are any more questions, let's see if there are any other announcements that I have for you. Let's see. Concierge physiotherapy service is available. So for anybody that either themselves cannot get out to therapy but needs therapy, or you have a loved one that's in need of some therapy and it's just too difficult to get them out due to maybe them having a stroke or just being older, and takes a long time to get them ready and get them out the door, or maybe they are unable to walk and they're wheelchair bound. In any of those situations, the person is a great candidate for home therapy or concierge physiotherapy service. Go ahead and reach out to me, and I will be sure that a competent and caring therapist will be dispatched to you. Let's see what else you've got going on. We are wrapping up actually the 21-day summer snapback challenge, and I hope that the participants had a good time. I do believe, well, I don't want to I don't want to be biased, toot my own horn or whatever, but I think it was the best challenge thus far. And for those that did not get in on this one, then please do make sure that you have an opportunity to join the next challenge. So if you're looking to improve your health and wellness and you have goals that you would like to meet in improving your health and wellness, then make sure that you take advantage of these challenges. It is a good and affordable way to work with me. If you're kind of wondering what the health coaching is like, it's a very good way to kind of get a little introduction to it. Okay, a really, really brief one. Let's see. For anybody that may be looking to get into my cancer recovery program, then you can go ahead and reach out to me again on the channels that we have previously discussed. All right. Let's see. We just got through with the sixth company anniversary was last week. We just got through with Bahamian independence. It's been an eventful 2 weeks, right? Let's see. I think that those are that's most of the announcements that I have for you at this time. And as always, if there's anything that you would like me to speak about, cover, anything that you're particularly interested in, because I only want to tell you about what you want to hear. So make sure that you are letting me know. You can reach out to me and let me know what it is that you want most to hear about and how you like the information to be delivered as well. I believe I asked a question in my stories today. I don't know if anybody saw it that is here, but I was asking, how do you like your information delivered? What's your favorite way to get your information, if it's going to be live webinars or if it's like on-demand videos, like something you could just purchase and download and watch it on your own time. Let's see. One question here: would you render those 4 stages of treatments? The 4-part treatment, complete decongestive therapy, yes, they all go together. So they're all a part of the treatment sessions. Okay. And once a person has kind of seen their physician, gotten their referral, and then they're coming through for the consultation, then I kind of let them know, well, this is what they're looking at. This is what they should expect. They're going to need also like supplies, so I give them, all the information that they need and make sure that they're like well prepared, like mentally to start this process. But yes, all 4 of the parts would be rendered by myself. And let's see. Yes, it's quite a process, but the result can be very, very rewarding. And it's an area that I am very passionate about and have been so since I was a student when I was exposed to it. So I always love it. I love to have the opportunity to give this treatment and to, give this, even to come here and give this information, because as simple as it may seem, there are persons that still do not know. I have people come through my office no later than this week, and I was like, well, did you know, like, to look out for this, and like not to do this. Did anybody talk to you about it? She was like, no. So I was like, that's the topic of the live stream this week. All right, but this information can only help if people can find it. So that's where I need your help, so that if you are able to like share this stream to your respective pages, so that more persons that need this information can get it. Okay, only applied knowledge is not power, only applied knowledge is power. Okay, so since I don't see any further questions, I do thank you so much for your time and attention this evening. This is Dr. Felicia signing off, making the world healthier, one woman at a time. Bye.